Most all activities that we do are depending on the weight-bearing extremities, which are our legs. So if you have an injury that affects your knee or your hip or anything in the lower extremity, it can have a dramatic impact on your quality of life. As hips and knees wear out, it becomes more debilitating to the patient, and they're not able to do those simple activities or things that they've done for their whole life for entertainment, things like hunting and fishing and hiking, exercise, running, jogging, bicycling. So when you have a patient who's been very active their whole life and they have gotten to the point where they've had to give up most of those activities, especially the things they really enjoy, they're very discouraged. Traditional hip and knee replacement techniques have served us well, and they've always been some of the most successful major operations that are performed with 90 to 95% success rates. However, they do have some limitations, particularly when it comes to accuracy. The instrumentation we've traditionally used to put the parts in has always been somewhat freehand, meaning we have some guides that get us very close, but it's not perfectly accurate. Our goal has essentially been to get the parts put in within a couple of degrees of what we consider ideal. And as long as we're able to do that, we typically have very good results. However, that means there are times when we are just outside of that ideal range, and although in the short term that may not have major consequences, we think that in the long run that does have some effect on patient function as well as how long the parts may last. Brigham Memorial Hospital has recently purchased and is the only facility in eastern Idaho to offer the Mako Robotic-Arm assisted orthopedic surgical system, which is the most advanced robotic surgical system for joint replacements on the market today. Robotics doesn't replace what we do today, it augments it. It's basically a way or a tool to do the same things we're doing now in a much more precise, much more accurate manner, which has some long-term effects that we're only beginning to realize. One of the most important aspects of the Mako robotic system is that it is extremely patient-specific, meaning each patient has their own plan that we create before the operation. We do this by having each patient undergo a CAT scan of the hip or the knee, which then is used to create a three-dimensional image of that joint. That three-dimensional image is completely unique to each and every patient, just like a fingerprint would be. That CAT scan allows us to look at the shapes of the bone, the alignment of the joint itself, as well as any bony or cartilage defects that can be present. By understanding the shape of the joint, we're able to more accurately recreate what that joint looked like when it was normal. The Mako robotic arm system allows us to be truly minimally invasive. We've been performing minimally invasive hip and knee replacements for quite some time now, but this allows us to even improve further on that. We're only taking away the minimum amount of bone. We're only cutting the soft tissues and things as little as we really need to be able to get the job done accurately. This also tends to improve the patient's pain level after surgery. The less invasive the operation, typically the less pain they'll have afterwards. By being less invasive, it also tends to mean a faster recovery. That patient is typically able to get out of the hospital sooner than before, whereas in the past a hip replacement might have been in the hospital for 3 to 5 days. We're now often getting those patients home the next day. So less time in the hospital, back to walking, back to stairs, and back to simple daily activities faster than we have in the past. Another thing that the Mako allows us to do, by being so precise with the placement of our parts, it tends to restore a more natural function and range of motion of that joint. Whether it's the knee being able to fully bend so that a patient can squat and kneel and go up and down stairs and those types of things. It can also mean return to a higher level of activity, even things like sports, tennis, bicycle riding, golf, all things that many of my patients have had to give up as their knee and hip arthritis has gotten worse over the years. The parts themselves are engineered to work essentially the same way that a normal joint does, but that's dependent on the parts being put in precisely and accurately. We think that that is what will improve the longevity or how long the parts are going to last. If they're put in precisely, they can share the load of the joint the way they're meant to, and ideally last the life of that patient. In the not too distant future, robotic technology will likely become what we call the standard of care for performing hip and knee replacements. I'm very excited to be the first orthopedic surgeon to be certified and able to offer this cutting-edge technology to the patients of Eastern Idaho. At the Orthopedic Institute, part of the Bingham Memorial Hospital Health System, we are committed to offering the best orthopedic care and technologically advanced procedures for joint replacements because our patients deserve nothing less.